Sufyan, a 9-year-old skinny boy, lying on the lap of his mother, tightly holding the longest scarf of hers. He was hit by his teacher under the ear. His mother told me that he was experiencing the lump in the neck since then. The mother took the child to the nearby practitioner, which he doesn't know whether licensed or unlicensed, to see and to seek the treatment. When she went there, the practitioner gave her, for the child, the set of antibiotics and antipyretics for a week. The mother gave the child the medicines, and the child was better. She forgot about the lump because the fever was resolved, and then she moved on. After complete 15 days, the fever returned. The mother took the child to the same practitioner again for the prescription of the medicines. The practitioner prescribed another set of antipyretics and antibiotics for another 15 days. The mother gave the child the prescribed medicines as she was prescribed. And this goes on until some of the relatives of the mother told her about the specialized cancer center in the main city. When she went there, the doctors suggested her to go for the child's diagnostic tests. When the diagnostic tests were done, the child was diagnosed for the 3rd stage of Hodgkin lymphoma. I had a maid called Zaika, 30-year-old lean woman, belonged to the rural part of Pakistan, living in the main city just to earn her living, with her 3 daughters and her husband. One day she came to me and she shared with me that she's feeling a lump in the neck. There were 3 lumps when I examined her. I immediately referred her to the doctor. Despite of having the specialized cancer center right across the road from my place, she chose to went to the government hospital because she could not afford to seek the treatment at the private center. When she went there, the doctor suggested her to get the biopsies done. She got her biopsies done, and she went back to her village without receiving the reports. And she never returned back. In our society, which is patriarchal, the woman cannot even fight for her own survival. She cannot even stand for her own basic right to seek the treatment. Despite of being the breast cancer so common, accounting for almost 25% of all other cancers, even then, in our society, the woman cannot even expose her breast. She's not allowed to expose her breast in front of the doctor, whether male or female, for the examination. And she cannot even talk about the breast symptoms if she's experiencing, because breast word would be the taboo, still a taboo in my society. On top of it, if the husband comes to know of her diagnosis, it would be so easy for the husband to replace his wife in less than a week even, leaving her children's responsibility as well as fighting all alone on her own with this devastating disease. I still remember a sad face, with eyes looking down, tears trickling down the face, while she was sharing a story with me. She was my breast cancer patient. She was diagnosed with a breast cancer, and she was left all alone with her children and the disease, fighting on alone, just because she was unable to satisfy her husband during the course of treatment, just due to the side effects of the chemotherapy. Just like Sufyan, Zaika, and my breast cancer patient, there are lots of stories to share. These are stories of pain. These are stories of suffering. Many children and even adults get diagnosed with cancer at advanced stages just because they do not know the early warning signs. They do not know how to navigate through the healthcare systems. They do not know where to go, who to seek the treatment for. They do not have a better access to the healthcare facilities and do not have the resources to spend for the treatment. The one who gets cured is lucky. According to International Agency for Research on Cancer, in 2022 alone, 20 million new cases for the cancer were diagnosed and 9.7 million deaths globally. Unfortunately, in Pakistan, where I belong to, we do not have the cancer registry. So we do not have the accurate data to report. Even then, according to WHO estimates, every year in Pakistan, there are more than 170,000 cancer cases are identified, with more than 100,000 deaths. Despite of available advanced treatment for the cancer, disparities exist in the health outcomes across the cancer care continuum. In high-income countries, where comprehensive services are generally accessible and available, more than 80% of children get cured of cancer and survive. In contrast, in low and middle-income countries, less than 30% are cured. Only 30%, this is because only 30% of lower middle-income countries can claim that they have the medicines for the cancer treatment available with them, as compared to 96% of the high-income countries as a counterpart. According to the evidences, around 50 to 60% women are still diagnosed with breast cancer in Pakistan at third or fourth stage, particularly in rural areas where health literacy and income is low. They do not have access to specialized cancer facilities, for which they have to literally travel from their locations to the specialized centers miles away. The evidence suggests that the people with low income, with low literacy, those who have no insurance coverage and have longer distances to travel from their home to the healthcare facilities are less likely to get screened and less likely to finish their treatment. On top of it, they lack the health literacy. So many people still do not have access to the health information that is required for them. They do not know how to navigate through the healthcare systems. Not only this, but there are a few hospitals in my country that only accept the patients at earlier stages, just in order to allocate the limited set of resources to the patients who have the high probability of survival. Though in my country, Pakistan, we lack the data, but the global narrative stays the same. And even the gap is wider in our country. Screening is hardly accessible for the people, particularly living in the rural areas, because they have to travel from their home back to the facilities, because they are more centered in big cities, and the comprehensive services, screening services, are not still integrated into the primary healthcare system. Despite of WHO's global strategy for the cervical cancer elimination, still a number of countries do not have HPV vaccine available. In Pakistan, cervical cancer is the fourth most common cause of the cancer among women. Still, HPV vaccine is not available. The question of accessibility will come far away. I'm Salima Khowaja. I was working as a nursing lecturer practitioner at Shaukat Khana Memorial Cancer Hospital, Lahore, Pakistan, till the last month. I belong to the same part of the world where these stories did belong to. My father was diagnosed with prostate cancer almost 5 years back. It moved us emotionally as a family. Yet, we fought back. Not all the families can fight back. Not all the fathers have their daughters or son as a doctor or nurses to stand by themselves. I simply can't ignore these stories, the stories that I witnessed every single day on my job. Because I know I can fix it. We can fix it. Many of these still resonate in my mind and have a special place in my heart. And this motivated me to begin my work around health equity. I have never found myself in so appropriate position to stand for these people, to raise voice for these people, to become their voice who couldn't speak. My work at Shaukat Khana Memorial Cancer Hospital has added in my experience and provided me the platform where I can initiate and I can contribute to the cancer prevention and advocacy, particularly in form of Community Nursing Task Force, which I was a founding chair of. And the fellowship, Atlantic Fellows for Health Equity, built my capacity to lead the cancer prevention and advocacy efforts. The fellowship has given me the right set of skills that are required to address these inequities, to navigate through the challenges, mapping the actors, building the relationships with the difficult people around us through one-to-one meetings. And I tried to do it, to ensure that the power to influence is not limited to yourself, but it is rightly distributed in order for the momentum to go on. To provide us the psychological safety where I can share the stories, where we can share the stories of suffering. It has begun my lifelong journey. My journey from being just the nursing lecturer practitioner to the advocate and a leader for health equity. And now representing the international platform, International Society of Nurses in Cancer Care, as the part of advocacy committee. That has been my success. And I'm sure many to come a year ahead. My work centers around advocacy and enhancing the health literacy among the people for the cancer and to work around the cancer prevention and early detection through innovative ways to engage them so that they can take the responsibility of their own health. People with disability find it even harder to navigate through this. Think about someone who is hard of hearing. They cannot even listen to the health information you are providing. Despite of standing here and talking so much about the inequities, I did not even realize it unless I got a maid, Zaika's sister-in-law, who is hard of hearing. I couldn't communicate with her. I struggled a lot. And I used to communicate through Zaika unless she left my place. And I was left all alone with her. I struggled communicating. Particularly, I remember the time when I was trying to teach her the self-breast examination when there was Breast Cancer Awareness Month. I intend to produce the bite-sized health videos for the people who are hard of hearing to make them more accessible. Zaika, Sufyan, Naida, there are so many stories. Similar suffering is witnessed globally. Everyone in this room belongs to a different part of the world, but inequities are central. Suffering is global. But the question here is it fair? Is it just? Is it acceptable at all? Suffering is inevitable, but survival is not. It's a choice to make. For the people's sake, inequities exist as the societies aren't fair. But it can be fixed if we truly will for it. Change is difficult, change is slow, but it sometimes needs the right time, the right skills, the right people to talk to, and the right tools. Changing deep down attitudes and the mental mindsets can bring the change to the surface where actually the inequities exist. It just needs one initial step. I'm taking that a step, and I invite you all to take that too, for something that matters to you. With this, I would like to call on Gladys to continue your efforts around advocacy, continue sharing the stories of the patients, and to continue helping them to navigate through the healthcare system. I call on Mario to help people for the availability and accessibility of the vaccines, particularly those that can prevent certain cancers. I call on Rachel, continue serving the patients and being their advocate. I call on Jan to continue healing the patients that you heal to. And everyone in this room, there are nurses, there are doctors who treat them, the hospital administrators, to ensure that the treatment available and provided is fair and equitable. Government stakeholders who have the power to influence, to make the policies more fairer, more better, and more equitable for the people to navigate. For the researchers to continue the advancement in the treatment for the cancer. Some of you who may be a survivor, or the friend or a family of a survivor, or know someone who has lost the battle against the cancer, continue sharing the stories. Come forward, support your own families and friends. ख्वाहिश तो रोशनी की करते हैं सभी, मगर सवाल ये है कि पहला दिया जलाए कौन? Everyone longs for the light to appear. But the question is, who lights the first lamp? Together we can, and we will definitely make the difference. Thank you.